We are now going to see how to fill in the consent forms required for surgery. Although this form is for surgery, almost all the consent forms have the same structure. So whether it is anesthesia or whatever procedure, high risk surgery, etc., the form structure is going to be the same, the content will be different. Since we are giving you the contents of the form, we are discussing only the format what needs to be filled in for any consent form. This is a consent form for surgery. Here will be the patient's name. Here will be the date on which the consent is taken. This is a UHID number, age of the patient, sex, IPD number if you have other than UHID number, ward or bed, and provisional diagnosis. The person, the patient, authorizes Dr. XYZ and his team for consulting doctor as required to perform the following treatment procedure. Now this is the procedure which doctor has to explain to the patient, and then whether tick in this, whether it's a elective, urgent or emergency procedure. Then all these terms are there, one you can read it. I am also aware that these simple complications, all that. Any other instructions specific to the patient you can add here. Now here the patient has to sign. Now there are some exceptions where patient cannot sign, like patient is minor, or he is under influence of drug, or he has just undergone a trauma, or he is in acute pain. Then the patient did not sign, cannot sign. His representative can sign. And you mention here the relation of the representative. It could be mother, father, son, daughter, daughter-in-law, friend, etc. Here will be the date when signature and the signature column here. Now this is a witness name where you can take a witness of third party and relation with of the witness, date, signature. Now this is a staff nurse who is taking the consent, has to sign here, and this is where doctor's name and his signature is required. Now his signature and time are most important things of this consent form. Many times we observe that the doctors never sign a consent form. See, a consent is given by a patient to the doctor for a specific surgery or specific purpose, and the doctor has to accept the consent by signing it, and hence this is very important to obtain a doctor's signature. Now if for some reason the patient has not signed and somebody else has signed here, then you have to write the reason for why the patient is not signed. Like you can say he was unconscious, or he is a minor, his local guardians can sign it, or he was under influence of this thing, he was disoriented, he was in acute pain, so and so forth. So unless this is filled in, the form doesn't get completed. Now this is in English version, same thing is in Marathi version also. If you want, you can use Hindi version as well. So note that all the consent forms need to be in bilingual. One is English, the other one can be a local language. Thank you.
This video is brought to you by Team Gadgil for training purposes. For more such videos, please contact us. Thanks for watching.